Hello, good morning, good afternoon, good evening. This is Dharam Singh, your host and your mentor for PgMP PfMP and your friend. Today I'm with very special guest here. His name is Ifthiquar Ahmed. He happened to be my PgMP student. He passed his PgMP exam on 15th July. So, 15th July 2021, very recent. So, you will find a lot of interesting things from him about PgMP. But not this program is not about only PgMP. It's about his experience in digital transformation, especially healthcare sector. And he will talk from the program manager point of view. So I'd like to welcome Ifthiquar. Good
Hi,
morning.
Dharam.
Yeah, welcome. And yeah, forgive me if I'm saying good morning because I'm in San Francisco and you are
Yeah,
at the moment in India.
true.
So, so it's evening for you. Good evening to you.
Thank you, Dharam.
How are you today?
I'm doing pretty well, and I would say good morning and good afternoon, good evening from which part of the world you are connecting from. I hope it would be a great session where I can share my experience. I'm
Yeah,
a learner like you guys all, and we are here to share our experience and learn from each other. And
exactly.
probably some of the points which I would share would help directly at your work, or if you are looking forward for your PGMP, definitely I think you would get a lot of valuable inputs as a student and also as a recent certified holder of this prestigious certification.
Yep, I'm sure. I'm sure. So guys, this series has been going for a long time now. So I have interviewed or invited lots of guests, just like Iftikhar. So if you have not seen the previous recording or if you want to learn from other professionals, so feel free to go to my website, not website only, but YouTube channel where you'll find all the previous webinars. So, and I'm sure you will learn from each of the professional I invited here. So, the purpose of this is to build a knowledge bank where you and the future generation, if YouTube is still there, can benefit from this discussion. I hope so. All right. So, with no further delays, welcome all of you. So, thank you for joining. I know it can be middle of night for some people, it's early morning for some people, but this shows your dedication. You are interested in learning and you're coming back again to learn from these sessions. So I'd like to thank all of you, and I'm very excited. I'm very hopeful that we're going to give you something new which beyond your imagination. Okay. All right. So if you don't know me, or if you're meeting for first time, my name is Dharam Singh, and I am currently in San Francisco, USA. I have spent a lot of time in Australia. I lived there 22 years before I moved here, and I worked for many organizations while I was in Australia for banking and telecom and government sector, many organizations. So yes, my resume was full of organization actually. If you want to hire me, probably think twice. But now that experience of working with so many different organizations with different people is helping me to work with so many professionals coming around from around the world to help them with with the PGMP journey or PFMP or PMP or RMP. So I cannot ask more than that. So I'm feeling blessed and honored to be part of so many such success stories. So just to give you some numbers, I don't know if you are following my numbers currently. I have now 346 PGMPs from 48 countries. It's more than 10% of global number. Yes, I am very happy with this 10%, but I like to see if that can be, 15%, 20%, why not? So the good thing is whoever is joining my program and you follow my direction guidance, you're very good chance that you will achieve your PGMP and PFMP. And Iftikhar, for your information, my PFMP, I have 73 PFMPs and all passed with above target. So my personal target is to reach 100, at least 100, without breaking the above target category, club. So passing is all happening, but having the result of our target, I can't ask more from my students. So people like you and my students are helping me to achieve my goals. So you are paying me to achieve my goals.
That's good to hear,
So,
Dharam. Great.
yeah. So thank you to all the people who have been trusted me so far, and it's all about trust and of course your dedication. So with Ifthiquar, as I mentioned, he has passed his exam, PgMP exam on 15th of July 2021. He's based out of Dubai, and he has done many big, large programs, projects, digital transformation in various sectors. And I think Ifthiquar can talk by himself what he has done. I will allow him some time. So so his experience working with Dubai government in health sector, transportation, I'm sure that will help you to learn from him. So let's talk, Iftikhar, let just introduce if you can, give
Sure,
more
sure.
about. I'm sure
Yes,
you
Dharam.
can dive more than what I'm saying. Yeah.
Thank you, Dharam. So, as Dharam rightly mentioned, I'm basically from India, but I've been living in Dubai for the last close to 14 years. And all those 14 years of my experience being in Dubai has been with the UAE government sector, especially with the Dubai government, particularly. So I was into infrastructure health space initially, working with Dubai municipality, and I happened to be an accident project manager first, and that's how I got into the project management field, I would say. This was back in 2010 when they want to do a migration of a system. They assigned me as a project. And being there, I moved into various different roles, and I started handling, I would say, complex technical related projects and programs. That's where the background being a technical engineer, basically an engineer in computer science. Typically, you have a lot of, I would say, technical implementations, integrations, and stuff like that. Moved into transformation role for the last, I would say, 8 years. In the last 8 years of my career, started from 2014 when the leadership had a great vision of moving all their, I would say, services of government services from web to mobile. This happened in 2014, and I was, I would say, honored and proud to be part of a team in the Dubai government who helped in transforming, I would say, many government services for a couple of different authorities. And I was part of that team to drive that transformation and build all those services in the smartphones that we have today. That was a great move from the leadership of the country, having a great vision, because at that point in time, people were having some kind of e-services on the web platform, but people didn't venture much into the mobile platform. And that was a great move. It was not just putting up your services on the mobile phone. You need to actually do a lot of transformation at the backend systems, improving the workflows that happens. It's not just the customers that you provide the services, or the citizens or the residents of the country or the city you provide the services to. It's even the internal staff that we have optimized a lot. With that networking and connections, I landed up a great role with Dubai Health Authority. This was in 2016. I'm still with them. I'm basically a specialist enterprise architect. That's my role title, as it say. But most of the time, my time goes in initiatives, delivering those initiatives in specifically, because there is a vision that is there from the organization's leadership that needs to be transformed into actual outcome where the end users can use the system. So typically, my programs last to 2 to 3 years. That's the longest program that I've handled so far. I've also handled the implementation of a public health disease and surveillance management system. Though might look like a complication set of words, in simple terms, it's a public health system. So, and Dubai was fortunate enough that we implemented that system in 2018. We started the implementation in 2015. The vision setting and the typical program directions and other aspects came in 2015. But 2018 is where we went with the first iteration live, and then 2019 there were a lot of enhancements that we did. But 2020 changed the plan, like any other organization, completely. but we were, as I said, blessed enough that we had a backend system that we scaled at length that even the product vendor did not try before. So that's where we will talk about it more probably in today's session about agility and then how it helps and how did we bring the program mindset into the equation. So typically you can, if you have any questions around healthcare space, obviously we have a guru with us on the program management and portfolio management, which Dharam can definitely assist. But anything on the healthcare space or the government services, you can definitely reach me out probably during this session or probably outside of this session as well. I can share a lot of insights. Basically, I'm the guy who has dirtied my hands, I would say. Okay, so it's not just I walked the complete walk, be it operations, be it support, be it development, be it I would say handling the strategic stakeholders. It's not just one authority. I mean, definitely in the pandemic, people have seen it is not just a single authority that can provide the service. It's a multitude of authorities that come together. So there are a lot of I would say benefits, and we could talk about even in the program management term. And we see when we connect all these, the outcomes that are coming out are something that we even did not anticipate. And this is what helped Dubai basically to open up much more faster than any other city in the world. And probably I mean, lockdown is probably an alien term for us. We don't have lockdowns from June 2020 onwards. So within a span of, I would say, 12 weeks, we were able to pretty much organize. And we are sitting at a day at a time where now Expo 2020 is being launched. So from tomorrow, there will be an Expo 2020 that will start run for 6 months. This is the best time I would say to visit Dubai because you're gonna visit Dubai, you're gonna see almost 170 countries in the Expo. So the best of each country would be displayed there. So that's an open invite to everyone who's listening to this webinar. Yes, Dharam. That's a brief introduction.
Fantastic, fantastic. Good. Thank you. And I have visited Dubai multiple times, and every time I go there, I get amazed to see such a beautiful city with so many towers. Every time I go there, probably another 100 towers with uniquely designed, beautifully designed, all these buildings. So whatever you're doing and people in Dubai is doing phenomenal job. You should feel proud of yourself, and the people living in Dubai or people contributing to the infrastructure and to the country's growth is a lot to take feel proud of. From the desert, if you go back many years, not many years actually, to what you see now. How many? 20 years?
Hardly 2-3 decades. Just
Yeah.
go back 2-3 decades. Yeah.
Yeah, 30, 20, 30 years, it was nothing, and now you see the world's best city with all kind of facilities and everything you want is available in Dubai. Everybody would like to go to Dubai. So yes, we didn't get any sponsorship from Dubai. We tried. We should have tried that. But there's no words to explain express the happiness you get in Dubai. That's a single sentence. So, thank you for, being part of the journey. And people, as I mentioned, the people like you who are involved in the government initiatives and bringing new things, and especially the COVID. And I know this COVID journey. You were my student at the time, and we were having discussion. And sometimes you got too busy, too much pressure going on. Of course, the firefighting was going in Dubai, not firemen, fighting with the COVID. So whatever you've done as a program manager and the leader, and it is great job. So that is giving me, privilege to have you, or honor to have you here in this special program. And I think people who are listening today will feel proud to see you live. And so, look, I have set a question for you. It's not only about talking a great thing about you and your Dubai, but more about getting to learn from you. And also, people have opportunity, guys. You have opportunity to ask any question if you are interested to learn about, Dubai and some of his work, or if you want to learn about his experience as PgMP and how he got there. Any question for me about PgMP or PfMP, anything, I will be happy to take. And actually, I will ask Ifthiquar to give his journey. May not be now, but we'll talk a little later, maybe around when we finish it. So if you are interested in PgMP, please stick around. And if you stay longer, you will be able to get a PDU code. And PDU code, if you are into PMP, PgMP, or PfMP, you've done it, that certification. Now you have to maintain your certificate. So I should not say every webinar, but most of my webinars, like this one, even the past webinars which are on YouTube, you can still earn PDUs from the past webinars as well. Not too far. I think if it is beyond one year, the PDU code expires. But anything which was recorded last year, last 12 months, you can still earn PDU from that. You just have to watch, and most of the webinars I've given the PDU code, and or I will provide you the PDU code during the class, during the session, via chat, and also via email. Okay. So, and also I have shared a video link to the YouTube. And this is where you can, if you are into PgMP, you can learn from this 1.5 hour video, where I'm explaining all you need to learn about PgMP and how to be, what exactly to do to pass exam. So of course you will see my different look there. Some people get surprised. Hey, Dharam, what happened to your long beard and long hair? So, I did like my old age, so I wanted to come back to my 20s. So I'm back in my 20s. All right, guys. So as I mentioned, you have opportunity to put your question on the question pad, and please make it as interactive as possible. Come up with your questions and any clarification. But I do have lots of questions for Ifthiquar. Ifthiquar, ready for my questions?
Yes, sir.
Okay. All right. So, and these questions are more coming from your experience in healthcare and digital transformation. And so, let me start. So, how has agility helped to unlock scaling in healthcare sector during the pandemic scenario? Look, we are going through a pandemic, and still not over for many countries. Still not over. We cannot say it's over. Still going up and down. So we still have to fight through and go out of this pandemic and feel proud of. But yes, how the agility is helping or helped.
Okay.
This
See, healthcare isn't different from any other sector. The only difference in healthcare is when you are working on either on a projects or on a system or on initiatives or even doing some upgrades. Everything indirectly has a point in touching, I would say, an individual's life. This is what I tell my team. This is the breakthrough session we have almost on a daily basis. Anything that you do is related to a patient's life. Indirectly, you are actually saving a patient's life, or you are probably pushing an illness to come. I mean, illness not to come, basically, pushing the onset of an illness, things like that. So, at the healthcare, this is the crucial thing that we all I would say focus about and then work on it. Agility has become one of the key essential parts because there is no more time where you need to do things at a faster pace. Okay, I need to learn at the same time and then apply and then change the directions that is required. So I would say you should, or a leader or a manager who is leading these kind of initiatives or projects should have a fail fast attitude. That's the first point that should be there. Second is bringing in concepts of design thinking. This helps a lot because imagine there is a lot of expense that goes in healthcare systems. The projects, I mean, roughly, if I can give even a public health management system, because these are management systems that can be deployed only by healthcare authorities. It is not by individual, I would say, institutions that can go and do it. You're talking at a scale of somewhere around 40, 50, I would say, million dirhams value of a product and an implementation, because you're talking about a huge population of a city, right? At that point in time, a lot of money is also being spent. So having a design thinking approach and bringing in the MVPs at place, like a minimal, I would say the minimum viable product, and tuning that product as you grow, and having a progressive elaboration. These are all the factors that basically helps in bringing the agility that is required in the healthcare space. Let me give an example, especially during the pandemic, and this is for many organizations, they would have different examples that they can share. For us, it's about two things that were there. One is we have a lot of patients because Dubai Health Authority, just to give a brief about what Dubai Health Authority does in Dubai, it is a healthcare authority which takes the role of a provider and a regulator. So we regulate all the licensing of the facilities, which should be facilities, which could be specialty centers, hospitals, clinics, things like that. That's on the facility front. And we also regulate the professionals, doctors, nurses, technicians, people who work on the healthcare field. So this is the role of a regulator that Dubai Health Authority takes. The other role is of a provider. So Dubai has 4 government-run hospitals, and you have multiple specialty centers, medical fitness centers, and then you have the primary healthcare centers, typically like how a NHS in UK has, or a different, I would say, healthcare institution at city level or on a country level has it. Now, for us, the bed capacity level was somewhere around, I would say, 2000s and things like that. We had to really scale up, and this is for every city that had the need at a scale up at a rate of around 300 400%, okay, to accommodate the load, to ensure that each resident or each person who is residing in Dubai gets the relative required care. That was the This is where agility helped us basically to scale up those kind of activities. And the second part is, I already have a list of patients who are being, I would say, getting the treatment and the care from their family physicians, could it be from specialist doctors and things like that. We need to move them because COVID suddenly placed a lot of restrictions where you are not able to go to a clinic physically. And there were lockdown restrictions that were had. Everyone went into learning process to understand. Information wasn't available with a lot of clarity. So we had to roll out a very quick, I would say, a telemedicine initiative so that we could help the patients be at home and then get connected to their doctors. We had the platform initially, and there was a lot of resistance from the patients themselves that, when what if? You will not believe, we had hundreds of appointments pre-pandemic. Post-pandemic, we touched somewhere around 12,000, 13,000 appointments in a month. So people started to trust the system, and then there were even for a lot of chronic patients were actually, I would say, consulted using this platform because they had to visit at a periodic interval of 2 weeks so that their status is being monitored. And we had a lot of medical devices that were also available, which through the home, I would say, home care that is available. And we had those initiatives through which we are able to get the vital information of the patients, and then where the providers or the physicians could provide the better care. So all this, fundamentally, you need to have that agility principle in mind. I mean, it's not like you do a lot of how do I say it? You do things, and if things doesn't work, you need to change the direction much more quicker, and then adopt to the current scenario rather than going with a traditional approach, because that doesn't help. Because we have a very famous saying, and then I use this probably in most of these sessions like these. You can't come and say the operation was successful and the patient died. That doesn't give you that doesn't say it, right? That doesn't. It's not a positivity out of it. So it's all about, you need to get things right. At the same time, you need to do it at a much more rapid pace, because, as I said, there is a human life connected to it. So definitely, Dharam, agility is one of the key core principles, and we are even applying some agile frameworks into the systems, into those projects. We are trying out. I would not say we are completely agile, because some of our processes are still a bit more rigid. So it takes time, and then definitely these initiatives takes time. It's not like over the night you can go and change. And one of the, I would say, the difficult thing to change in an organization is the culture. So we really do a lot of change management to understand, and then probably for a unit or for a hospital, a part of it works fine, but for the other hospital it doesn't work in the same way. So we have a lot of fine tuning that goes along the way. And definitely, for all this, you have to have the great leadership at front who supports you, who believes in the team on the ground, can go and make those tactical decisions and deliver.
Perfect. Very good job. Very good job. Thank you. Thank you, Ifthiquar. And just for the benefit of people, it's not only we're not talking agile methodology or something which you use for Scrum Master or something like this. It's not that. We're talking agility, fast process, quick change, decisions, fast. You, as you mentioned, fast, fail fast. All these things, try out and learn from that. Yeah. Very, very good. Very good. Thank you.
Hope your questions will not be as I would say not tough, but trickier like PgMP.
No, you passed the PG exam,
Yeah.
exam, so that's not tough anymore for you.
True.
All right, so I'm getting questions. I will take the question a little later from the audience. But let me have another question. So why is program management necessary in restructuring the existing business model in the healthcare sector?
Yeah. See, that's a very good question as well. I mean, this program or a project management, PMO offices, these all become the fundamental blocks, basically the block stones, I would say rather, where you would be able to, I would say, reap in the benefits or the outcomes much more in a more granular, refined way than without having the structured processes in place. One of the key things that I got really fascinated about during my journey in PgMP as well, when I started reading about program management and stuff like that, even this is covered not just in in the PMI's PgMP, but even in other I would say SACA material, and then you have different bodies of knowledge that talk about this, which is benefits management. Now, this is an extreme I would say key area. Though in the PgMP as well, it talks a lot about the benefits management. It has a life cycle of the benefits from the time you create the benefit till you sustain that benefit. So having a structured process in place, like a PMO office that is built on some methodologies of PMI, or you can bring Prince2 or any other methodologies that are there, you would be able to definitely a project is there to provide you an output or an outcome, and then that outcome has to get sustained, or else there is no meaning in that outcome that is being delivered. So having that knowledge, I would say, of program management helps into delivering the real-time projects, like many projects that I can talk about. One of the initiatives that we did, which is a massive initiative that is still in progress, it's a program of people who are in the healthcare space would definitely know this about healthcare information exchange. We talk about HIE. You have this in US already, in UK, or probably sorry in Europe. Some of the places are well matured with HIE, and Middle East is also starting up. Abu Dhabi has one HIE platform. Now, Dubai also has. We also have an HIE platform where we have like 35 plus providers. So what are we talking about is interoperability. So I have a patient that goes into an hospital A, and tomorrow for any reason, typically we do in our daily lives, we go and take a second opinion, right? Probably the second opinion doctor says, repeat these tests again. Why do we need to repeat it? Because I've already done the tests there, and even those institutions are authorized or regulated. So having an HIE platform helps us to share the data in a much more, I would say, secured way. And this is one example I'm giving about the benefits. So when we started, looking at the HIE initiative, it's not just, okay, let's go and build a HIE platform. Excellent, yes, you will have an HIE platform, but what is the benefit out of it? What is the value that I would say a city generates out of this? So we had a lot of benefits. Like you can have, full information about the public health atmosphere within that city. This helps basically for the city to prepare for any kind of epidemics. I would not say pandemic. Pandemic is a word probably we came across, and everyone knows it from 1 year old till a 90 or 100-year-old these days. But epidemic is a common word that is used in the public health space, where you have a kind of a small bird flu or any flus that are there. So having these kind of, I would say, program and project management principles set in place in an organization helps us to, I would say, helps us to look at the projects not just as a project, but as something that is gaining a benefit and sustaining a benefit. Typically, like how I would say organizations provide products and stuff like that, where they see a benefit. It's not only monetary, because being in government services, It's not something that we look at monetary. We look at the different perspectives, the wellness of a person, the well-being of the individual. Because if an individual is healthy enough and his family is healthy enough, and then you have a lot of productivity that comes in from a city level as well. So those are the aspects that we try to tap in, and we try to monitor those benefits. It's not pretty easy. It's much more complex. There is a huge team that works on it behind, and then we are able to measure that. So definitely, there are those. I mean, foundations of project management and program management. It definitely helps actually in those outcomes.
Exactly. So, as you correctly mentioned during the PgMP learning, standard for program management, we do talk a lot about benefit identification and then analyze and plan them. And we have a delivery, and you transition them and making sure we have sustainment. So the operation team or the team which is going to take over from you, they have all they need to sustain the benefit. So, the way you present it, it's perfect. That's what it should be. You identify the benefit, you've got the team working, and then once done, hey guys, make sure you have, you're doing it. All the measurements are happening, and you have all the logistics, team support, everything is provided to them. That's where actually that's one of the reasons many programs are successful. If you handle the benefit effectively, the success of programs become much easier compared to just deliver something, and many times you don't take everybody into consideration, and the program, yes, you deliver on time within the budget, everything's done, but customer and stakeholder is not happy with that.
True, true.
Perfect. So I will take a question which is coming from audience. I think very similar to what we have discussed. How to use the knowledge of agile, scrum, safe, less. I think that's another safe agility. DA in respect to handle the program. In other aspects, how do the tailoring in such a way knowledge implementation of program, PgMP and agile in healthcare domain. So I think you have covered the program management aspect in this.
Yeah. See, I mean, that's also a very interesting question, because this is some common questions that we have, and we debate a lot. Basically, I would say there is no one correct answer for that. But what I would suggest is, I mean, like I keep saying this: you bring in any consultant, no one can fix how your house should look like, right?
Yeah.
You have a taste, you know what things to be placed, you know how the dimension should be. Definitely, when you have a clarity in those aspects, you can go bring a contractor and get the work done. You can bring 10 contractors and then manage the 10 contractors to do a piece of work, and then you integrate them. So safe is a lot more that we are also trying out as an organization now. Though I would say we are doing at a much more, I would say, smaller scale, and we are trying to tailor and then combine all these different, I would call it, I mean, as if they are different bodies of knowledge, and then try and stitch them together and see what is the best outcome that you can bring. So we also have our own, because being an enterprise architect is also I do most of the time. It's not just the technical architecture that we look at. We try. So my role typically stands in between the business team and the technical team to ensure the vision or the strategic goals and the objectives is translated into those technical projects that are being done, and in the way that it fulfills the vision of the organization. And that's the I would say target that we aspire to reach. Now, looking at these different bodies, SAFE is definitely a great thing to start. But one of the key things I would probably share is to have the leadership team support. Without a leadership team support in SAFE, it's going to be a very difficult ride, because it is not just talking about one aspect. You need to bring in the whole business team, especially having that agile mindset that is very important. And then I mean, I'm not going to talk about the Agile 12 principles or the Agile manifesto. I mean, you guys would have definitely read about it or know better than me. But bringing all those information, and then the critical thing comes is the leadership at the SAFE, because especially when you do a PA planning event, and when you do a PA planning for like 8 weeks or 12 weeks, those increments that you need to, so you need to bring in a good team of 100 people, and they all have to work together on the same vision. The second approach that we're also slowly, I mean, like I would say, that is getting transformed, or probably this is at a larger scale, not in the healthcare space, probably all different verticals that are getting transformed, is looking at the product management. Product management has been there for a very long time, but now people are looking at it a more, I would say, in a very refined way, because they are seeing benefits that are much more larger, because that are much more, it doesn't, so you have a project life cycle, you have a program life cycle. Typically, there is a product life cycle as well. When you try to stitch in and combine all this, and you can even create your own kind of a framework based on the organization needs and the strategic visions. Definitely, those all things help together. But there is no, I would say, common framework that you can say, you know what, let me take this, go and apply it. It doesn't work that way. Something that works well in US healthcare, it's not gets applied in the UAE space. There is a lot of, I would say, regional requirements that need to be fulfilled. So all these aspects are there, basically.
Perfect. Thank you. Good. All right. So, Ifthiquar, I have third question for you. How has COVID-19 changed the way the healthcare sector works? And if you can share some challenges you faced during the crisis.
Yeah, I mean, definitely, COVID has given me a lot of gray hairs. You can see now. I'm also getting younger day by day with gray hairs. Definitely, yes. If I say no, you guys will say thank you for the webinar, because we were at the core front as in healthcare sector, where things. I mean, obviously, I'm not a clinical person. I'm not a doctor. But many people call me Dr. Ifthiquar. I tell you, I'm not a doctor. Because you happen to move with a lot of people, and they presume that you are also from, I mean, like from the clinical side. No, definitely, it has changed. I mean, how the healthcare system is viewed. I would start from a very high level, from a, though I'm not a representative of a city or a country, but since we are in those leadership teams, I mean, like, we are part of those discussions, and it is something that is outright in the public as well. Every country's healthcare expenditure has increased after COVID. Okay, because nothing. I mean, like, a health crisis had stopped the whole world into a standstill at some point in time. Right? This has never happened before. I mean, probably it has happened earlier, which we read in the books, and then we try to learn, and then we know of it. But everyone has witnessed in the last one and a half year what happened. Particularly in the healthcare space, it all talks about people or organizations that had electronic medical record systems were able to, I would say, sustain and then also transform the way how the healthcare, or how the I would say, things are delivered, basically. But people who were stuck to traditional levels were probably wiped off. This happened even in the 2008 crisis. I mean, like, I will not talk about much about that, but we have seen that people who didn't had a proper business continuity plan had a lot of I mean, like, they were not even in the market, right?
Yeah.
Now coming back to the healthcare, the challenges that we faced were two things. One, we were like everybody else. A lot of our workforce changed remote, and we had to ensure that we have, because we are a government organization, there is a lot of paper that gets moved within the organization. But again, I would say, definitely from a leadership of the city or for the country, where they had great initiatives. One of the initiatives that were led by another entity from Dubai was to have a paperless, I would say, transaction with all the government services, not just with Dubai Health Authority, with every authority within Dubai. And the strategy, and already we have moved a lot. Today, I mean, we are proud that 80% of our transactions are paperless. We don't have paper. Yeah, 80% of the transactions. You get a contract with us, it's completely paperless. You digitally sign a contract. I mean, no paper signing, stuff like that. Though there are some processes that are still connected where a paper is required. Like, if a child is born, I need to give a birth certificate. I mean, that still is in the paper. Because those kind of things are some of the exceptions, but most of the other things today, we don't give a discharge summary to a patient. I mean, like, though we were so how it changed us is basically the systems were there in place. The adoption was extremely less. And this is the positivity that we saw in the pandemic, that we
Yeah.
were able to increase the adoption. And when people started to use it, they were like, I mean, this is much more better because I could carry my prescription anywhere I go. I'm not dropping my paper, and this is record is very secured. I have access to my record. Nobody has access to my record. Stuff like that. So they were much more happier when they started to know about those services. And we typically increase the number of services that we generally provide. So a lot of services are today, like I'll give you an example of a service. Uh, so there is a process where you take a sick leave, and then a sick leave has to be attested by a Dubai Health Authority. I would say from a regulatory front, right? What we did, we automated the complete process. Previously, someone will go to a clinic, take the sick leave certificate, go to the administration counter, put a stamp, pay the fee, and then they will submit that certificate to their employer. Now the whole thing is completely digitized. They don't need to. So as you finish I would say the encounter with the doctor, that episode is completed. You would be notified that if you require a sick leave, and then you will follow through the process. Everything that you will do it with your mobile device, and then it is secured. I would say certificate is sent to your mobile link, and then you can use that across your different purposes that you need for. So this is one quick example that I can share. So a lot of things have changed, not only for the end users, but even for our internal, I would say, clinicians. A lot of workflow enhancements that we were able to do, and things are much more at a very rapid pace. Telemedicine, I mean, helped us a lot because we could have even the doctors stayed in their homes for, I mean, like not the pandemic, I would say, related doctors who are handling the patients, but the duty general physicians who can stay at home and then provide the required care through the telemedicine platform. Another thing that I could relate is probably we might talk about AI and other things, but it is good example that I can bring in now, where what I mean, since there was a lot of, I would say, not clear information available, things were changing at a rapid pace. We don't know how the flu is going to behave and things like that. I mean, when the mutant variants are coming out, there are a lot of I would say ambiguity is there. Not the clarity wasn't there. We were flooded with calls. Our call center was completely flooded. So we had to really think very quickly. We deployed, I would say, some AI-based solutions where we were able to answer a lot of the common queries. We picked up a lot of common queries that we are getting, and typically those projects, if you ask me today, like in 2019, I would give a timeline of 6 months. We were able to do that in, I would say, 6 weeks or 8 weeks time. Even the complete procurement was completely transformed. Even they became agile. They know what is agile. So a lot of things have changed. We learned half of the medicine during this process. A lot of doctors learned technology during this process. So a lot of knowledge sharing that went on as well. So those were some of the experiences.
That's good that while we all talk about bad part of COVID, I mean it is bad and in many aspects, but it has transformed the world, the way we were doing work. We were very slow, remote work. Of course, IT was a different thing. We were able to work from home, but now even the hospitals and constructions and many other places or government organizations, we never thought they can work from away from the big desk, big fat PC. They are working, and they have to. And as you mentioned, things happen very faster rate. Instead of 6 months, you're able to get it done in 6 weeks. 6 weeks. Everybody is thinking agile. How to get the things faster, better, and everything. Everybody has that one thing in mind. How to provide the benefit to the end user and minimize the impact of COVID. Bring the city back on the foot as soon as possible. And that's where you guys again. I'm appreciating and praising your work or everybody's work. You did a really good job, and you should have every reason to feel proud of. Good, thank you. Okay, so how does Dubai Health Authority able to give the healthcare system a clear, visible value creation?
Okay,
Clear,
I mean that.
visible value creation on healthcare.
See, definitely this goes back to the leadership where they set very strong, I would say, ambitious goals. which drives us basically that it is possible. This goes into multiple projects and programs and the initiatives that the government is leading. I would probably say this. I've not seen this much because I've spent most of my time in UAE. Here, government is most of the time at the leading front compared to the I would say the private institutions. Most of the other places that I've visited, I've seen, you would see that a lot of private organizations are leading, but here the other way around, you would see the government is at the leading front and then pushing and getting those initiatives to happen. So that is one of the strong reasons why you see a difference in completely when you come in. And of people who have even visited Dubai, they would see a big difference from any other place across the world, right? So that is extremely important. Having a clear vision of, of why it is required, not the how part. How part is left to people on how to go, and then you deliver that part. So that's a very key ingredient. And then second is the tactical team that are there who are helping us to basically deliver those parts. So people like me, and then there are a couple of my colleagues, and then my I would say CIOs and the CEOs who I work with closely. They have a great attitude that they bring into work. It is not. It is bringing in a lot of, I would say, the growth mindset compared to a fixed mindset. So when you have a growth mindset in place, you are looking at multiple different perspectives. It is all about. Like I have had managers who have come to me and said, you know what, I want you to fail so that you learn from that. And these are some of the really, I would say, golden words for me, which gives me confidence, and I can take that confidence back to my team. It's not like no one works to fail, no one studies to fail, right? But
Exactly.
but when you know the path, when you go through that path of failure, I would not say failure, it's learning lessons. You actually come back more stronger, and you probably since you have dirtied your hands, you know things how it works, and then that's what I call it as experience. And
Exactly.
for that experience, you need to have a leader. I would say a very good team who can deliver that, and then you believe in them, basically, which helps you to generate those values. So these are some of the key elements. I know I'm just giving a very generic term because it's a very elaborative
Yeah.
question. I don't want to go in detail just to value the time. But these are some key elements that helps us basically to generate that value we provide. And definitely, if you could see it's very wide open. It's nothing to hide. If you look at our reviews of our app, so if you see DHA at one point in time, and this is my the program that I handled very initial during my days in DHA. We had multitude of apps. We said, why are we creating so many apps for different needs of the customer? Let's combine them into one flagship app where I can provide all those services. Now that initiative has really become so strong. I think we were even leading in the app store for some few days on the app levels in terms of the most downloads, because we were giving a lot of valuable information that was helping every resident within the city of Dubai. So those were some of the elements that helps basically to generate that value that organization is looking forward to.
Yeah, perfect. Good. One thing you mentioned, the fail, allowing you to fail, and I correctly mentioned it's not, hey, go and fail. It's not about, it's about trying out, giving you confidence. Even if you fail, doesn't matter. We are here for you to support. So, you fail, and you learn from that. And next time you get up again and do it better.
True.
And that's one thing if you remember, with the PgMP process we've gone through, I asked my student to go through Dr. Ginger's question. And I know some people, hey, don't talk about that. This is one of the most difficult, she has the most difficult question, a complex question. Everybody can say that. But I asked my student to do these questions, not to bring the confidence down. It's okay. You think that you know everything. Instead of failing in the exam, fail now. So in failing here, you can recover. But if you fail an exam, it's a costly exam. Of course, every exam, every time you're going to $600 plus confidence and another 6 weeks going into that. Fail now so that you can recover and learn and then go to the exam with more confidence. I think it goes in parallel, which allow you to take chances and learn from that. Perfect.
Definitely. Yes.
Okay, so thank you. It was very good. Very good. All right. So now, what are the challenges to drive digital transformation in healthcare sector? What challenges did you face or did you face?
Okay. Before I go into the challenges, probably I should have discussed this much earlier. Uh, when you look at the healthcare space, we are talking about basically three major, I would say, players. One is a payer. Okay, these are
Mm,
the insurance and the other aspects that come in. And second, you're talking about a provider. A provider typically is the hospital where they provide the care and the other elements. And then third is a patient, right? So these are the three P's in the healthcare space. And I probably can add one more is like a regulator as well, because you need to regulate these elements as well. So the challenges that are there, it is basically need to when you talk about digital transformation, uh, most of the people when I talk about or when I discuss with them, they talk about having a very fancy app or a great looking website. This is what they say. This is we have done a digital transformation. We have transformed it. Though what they miss is basically yes, they have transformed from a more, I would say, static or a sluggish looking website to a very nice looking website or a mobile app. Okay, so if you don't work on your internal business processes that are there, these are the backend systems that I'm talking about. You're not really would be able to achieve those transformation projects. So a couple of things that we worked out is basically from a healthcare space, we have done a huge electronic medical record transformation as an authority. It was a program led by some of my colleagues, and then we have done a huge implementation of the complete medical fitness, I would say, screening across the city of Dubai. That's a major initiative that we're there. So when we do these kind of, I would say, transformative initiatives and projects or programs, we are not just talking about one authority. So the key challenge is to ensure that you have stakeholders from multiple different organizations that are involved. You need to rightly identify them, because if you miss a key stakeholder, that's going to be troublesome in your delivery part, and it's going to even hamper your whole program, or probably even can bring your whole program to a standstill. So
mm,
making sure you identify the right stakeholders. There are different methods that you can apply. I'm not going to talk about those methods here, but I mean applying them in real sense and ensuring that they are engaged and they are, I would say, fed the right information at the right time based on their preferences. This helps basically to handle much of those challenges. And uh, the complexity comes is not, you have internal stakeholders, you have external stakeholders as well, and there are a lot of viewpoints that get, I would say, clashed. So this
mm,
is where you bring in your steering committee members who are able to basically guide you and then give a direction out of it. Our duty as program managers is to basically show them the multiple options that are there and what are the consequences or the end results that would be based on each option. And some of the decisions you would not be able to take as project manager. There are steering committees that you need to take it forward to them, which they help basically looking at the vision state of the program, and they make the right decision that is required. So it is always about collectively transforming I would say, the existing health system, basically from, so all when we do this, we are collectively transforming the health system from a treatment based reactory care to more a prevention and well-being model. So typically, people look at healthcare as something treatment based. So you have this problem, okay, let me go look into this problem and go and solve it. Today, we are looking healthcare in a much more different paradigm, where we are talking about the prevention, probably the onset of illness, how we can delay it, because some, for example, if you're diabetic, for example, right? You're so not you are diabetic, your parents are diabetic. There are high
mm,
chances that you will get diabetic, right? But there are a lot of, today we have the I would say social screening programs that are there available with us, through which we look at multiple different. I mean, we help build the tools, and end of the day, these are the clinical doctors who review that part. When they look at the state, they say, you know what, you probably might get diabetic, but how can we delay the onset of a diabetic for 10 more years? Now, this is where we are talking about the prevention. This is where we are talking about the healthy lifestyle, the well-beings, and other aspects. These are, I would say, I know I'm connecting two different subjects here, but when you understand all these aspects, this helps us to overcome those challenges in those I would say initiatives or programs. So trying to have the right people on board, the right stakeholders, and to adequately engage them, this definitely helps.
Perfect. Great stuff. Great. Thank you. So the nicely presented. So I have a question. I wanted to know the tools used as a program manager.
Okay, tools used as a
What
program.
tool did you use as a program manager? Where in
Okay.
this kind of scenario?
So we deployed multiple different tools. So one was we had I would say the Microsoft Enterprise Project Management. We are using the latest version, the project server. So that is one of the tools that we use on a day-to-day basis, where we manage the risks, the issues, and the planning part, and the resource management part, and all those elements are done through that. We also have a combination of we are using a hybrid model in our organization. I would not say we are completely agile. So in the hybrid model, we are using the Azure DevOps as well. So we have tried out on multiple different tools, but we are using the Azure DevOps because most of our applications are .NET based, and it is much more better that you use that platform. And we also use things like Trello for us to do some bit of the, I would say, the activity tracking part. Though we have an EPM, but we found the Trello to be much more quicker. And definitely having the Microsoft Teams and then the multiple different tools. So there are a lot of different tools that we use that are there. Specifically, I would not term a single tool that gets its job done. Because I've been using multiple tools at work as well. Everyone has its own advantage and then the disadvantage. And I would not also recommend using a lot of tools because you spend time in integrating all of them.
Integrating,
That becomes a project by itself. So don't waste much of the time there. Look at the scale. See what works better. There is no, I would say, a silver bullet for everything. So you need to just tailor it a bit based on your requirements. And these are some of the tools that we have used as a team in delivering those initiatives.
Yeah, actually, I was about to say we do have silver bullet, which covers the whole organization in one place. I mean, I did send you some information about that digital command center, VXDCC, where everything happening in one place, including your organization strategies and the portfolio management, program management, project management, which is connected with
Yes,
your
you talked about
HR management and your supply chain management, sales management, all happening in one place. And you said you don't need too many platform and tools. Yes, you need only one platform. So, of course, you have the information or anybody want to know more about it, I think that's a game changer. We are currently working with Formula One and actually happen to be Dubai, or there are a few other customers we are rolling out. So if anybody has interest or fed up of using spreadsheets or anything, yeah, please call me. I will be more than happy to discuss. Maybe we can do something with the Dubai healthcare or something to do the demo or something. But yeah, anyway. But anybody interested to do the digital transformation, that's we have a platform, and that is a silver bullet. Actually, if you have heard about it, we have it. Anyway, so I have next question for you, Ifthiquar. We have talked about more affordable, more accessible, in terms of healthcare sector, where the government and the private health sector have started adopting change to develop an effective healthcare ecosystem.
Yes, definitely. We are looking at, I would say, a lot of PPP models, public-private partnership kind of models, where it's no more just the government authority that works, but we are also bringing in a lot of, I would say, players into the market from a private because they can do things at much more rapid pace than us actually. And then we bring in a lot of learning as well because they have a lot of those learning curve going in a different direction for them. So definitely these are some of the models that we have. Dubai is also, for people who don't know, there is something called Dubai Future Foundation. Now, if you have a great idea, I mean, this is, you can go and then just Google it about Dubai Future Foundation. If you have a great idea, you want to share an idea and then make it a reality, you can write it to them. And if your idea is selected, you would be asked to come and present it. And they would call authorities like us. It's not just Dubai Health Authority, multiple different authorities that are there within the government space. There are around 36 government organizations within the government of Dubai. I mean, I'm not correct on the number, but somewhere around 36 to 40. Now, these entities are invited, and where we look at basically breakthrough solutions and things that were like really transforming, be in healthcare space or any other space. So we do a lot of proof of concepts on a quarterly basis. That's where you could see all those transformations happening in Dubai in the recent times, because we as a city are not shying away to try on things. So we keep trying on things, and then we move it at a much more, I would say, controlled but a rapid pace. So those are the things. And one example I could share is where when you're talking about the more affordable, more accessible kind of words that are used in the healthcare sector avoid a lot, right? So we did I would say it's a project that we did back in. It's more of an healthcare analytics, I would say, project where we are getting a lot of KPI related information from the different, I would say, hospitals or different healthcare providers within Dubai, within the city of Dubai. This is within the city of Dubai. The outcome of it, though it's still a working project, but how would it value a resident is if if there is I mean, like for maternity, they want to know which is the best hospital to go and then to have the childbirth. What is their rating? I mean, how is their experience? I mean, not the experience. I would say, how is the facility rating that is there? What is the waiting time that happens at each levels? All these informations we are collecting, and we will probably publish this information for the wider city to use. So each resident can make their own choices, and then they can know how much it would cost, much more upfront, and then get the, I would say, the experience of the other people who have visited that. We will make it more open. Definitely, you would say there are Google reviews and other reviews that are available today, but we are trying to combine this all into one space where it provides very, I would say, detailed level and the required level of information for that individual so that he can make more informed decisions. So these are some of the initiatives that we are working on. It's still a work in progress. A lot of work has done in the back end, and hopefully this will be released for the end users, I mean, for the residents of Dubai. So those are some of the elements of affordable care, and I would say the accessible care that is available.
Perfect. Fantastic. Good. Thank you very much. I have shared the PDU information on the chat. So anybody who's watching now, please check the PDU information. So if people who are watching after the program, you don't have access to chat, but feel free to send me email. Hey Dharam, I watched this video with the Ifthiquar. Please send me a PDU code. I will able to do that. So I used to share on the webinar, but we are advised that we have to give them according to once they watch, and the PDU is for professional development units. So this is given once you have really done something. Of course, this kind of event, this kind of information you are learning. So please check the chat. I'm sure you can see that. If you don't have, let me know. I will reshare it again. Okay. All right. So like time-wise, we almost actually over. And if I like to, get some learning about your PgMP. I know we have a few more questions to do, but let's talk about the PgMP. What made you to think doing PgMP, and all the way? Take a few minutes, and hopefully that can also help you. Yeah.
Definitely, I think this would be if you're an aspirant looking to crack the exam, or you want to get more information about program management, probably this what I'm sharing now would be definitely helpful, because this is coming from my own experience and from the different, I would say, researchers that I've done as an individual. So for me, I mean, PgMP, when I thought about PgMP, this was like immediately that comes is after you finish your PMP. This I did in 2015. It's like, what next step is, let's go and do a PgMP. So when I went through the requirements, I said the requirement is so huge. I just closed it. I said not now. And you get it eventually busier with multiple different things that is happening at work, at family, and things like that. But that was somewhere waiting at part of my head that I need to get this cleared as a PGMP. It's not just from a certification point of view, but I wanted to know that knowledge. And I also learned during the course of time that there are only very few, I would say, probably now the count is, maybe you keep account of all the professionals who are there. So it's a much more elite certification, less than 4,000 or
Yeah,
probably
less than
close to
4,000. Yeah, 3,500, 3,700.
yeah, professionals that are certified around the globe. So that gives you a niche elite placement that you say you can put it in your profile, and then even I mean, like, probably brag about it that I'm a PGMP holder. So all those things are there, but I want to do it right. I don't want it to probably go into multiple different directions because I had initial my plan was, let me go and finish this in a 2-3 months time, and Dharam knows about this very well. So though there are, like, I would say, other mentors that are available in the PGMP space, I'm fortunate and enough to connect with Dharam, and immediately we had the synergy, and I said, you know what, Dharam, let me take the course, and I took the individual, I would say, coaching from Dharam. That was really because it was helping me to accommodate my schedules accordingly, and then
Yep.
I mean, Dharam was much more accommodative, though we are like 12 hours apart from the time zone. We were able to work out on a common time. Sometimes things don't work on evening, we do it in the morning and things like that. We kept shuffling, but with a lot of good planning that went in. So taking his coaching definitely helped, but again, that was only, I would say, 20% of the job. 80% of the job remains on you doing the work in terms of reading through. So definitely the first part of the PGMP journey is to get your application ready.
Yeah.
So I would recommend anyone who is looking to go into PGMP, read the SPM, Standard for Program Management version 4, at least once. Read cover to cover at least once, and then start filling in your application. Uh, Definitely, there are a lot of videos from Dharam. There is material from PMI, from other sources also that are available. Uh, Use a lot of what you did as in the program, not what anything that comes from the book or stuff like that. Explain it in your own words, because that helps basically for people like Dharam, or maybe like me, or someone who gets your application, if I'm part of that group or things like that, to review the application and then probably to move it through. If it is from the book, it will be really difficult for someone to basically, I would say, pass it through. So that's the first level, clearing the. So once you finish the application, uh, you will submit it, and then it goes into I think a quick screening or something from PMI, and then goes into the panel, which you're asked to pay the fee, and then it goes to the panel. The panel is the first test. Now that is so. So take your time in filling those 5 questions. So you have an option of A and B. You can select A or B, but you need to explain why did you make a choice, and then given a lot of examples from your own words on, and from your own role as a program manager, not as a team. Though we generally work, we work as a team. It's the we that we use, but here you have to use a lot of I in your application. So use that, fill in your application, and then once, for me, the panel almost took like 4 months. I think I was the most exceptional guy. I don't know why, but
Oh,
my panel took
yeah.
a lot of time.
More combination of a COVID, pandemic situation,
Yeah.
and less staff available, and
So at
it can take
yeah,
up, it can happen.
true. At some point in time, I even stopped reading the standard. I mean, even I said, Dharam, let's wait for the panel to complete, and then we will continue with the classes, because it was really, I mean, like, time consuming. But don't let your confidence down. I would say that's a good time even to, I would say, prepare and study the material and get ready, because at the end of the day, once you finish that panel, the next level is to sit for an exam.
Yeah.
So so for me, I submitted the application. I think it was in December 2020. My panel got approved in April 2021. So it took a lot of time. Though it doesn't take that long, but it took, in my case, a bit longer. So once in April 2021, I got it. That's when I got very serious about program PGMP. So before that, the good thing was, as I said, I had PGMP on my mind for quite some time. 2019, I happened to purchase a book from John Wicks, Marshall Bellet. This is a very good book on I forgot the name. I'm sorry. About the
No, but
PgMP
even if you
guide.
give the name, even if you give the name, the book is not available anymore.
Yeah,
They have
true.
a great book, but they stopped publishing it.
True. So
So
I happen to have that book that helped me basically because the questions are good structured. Though there are no questions that similar kind of questions you get in the exam, but the questions are really good structured. They have different like the full 2 set papers they have, and then there is a tutorial kind of an questions that comes after each chapter. So it really helps you scenario based questions, direct questions, things like that. Not direct questions. I would say one word questions, stuff like that. So that book helped me. And as Dharam said, I was also skeptic about using Ginger's book. I said I went into the Amazon reviews. There were very bad reviews about it. I said, Dharam, do you really want me to purchase it? He said, you will not regret. So I said, okay, fine. You are my mentor. I would follow you. So I went and purchased the book. The book arrived a couple of days earlier and than what it was planned to be. And I gave so I start what I did was 6 weeks before the exam. I said, you know what? Every Saturday I'm gonna sit down from 9 till like 9 a.m. till 1 p.m. Like an exam environment. I'm gonna take the test questions. I'm gonna because I had good amount of material. One is was from Ginger, and the other book that I had Dharam's Challenger questions as well, which I kept it till the end. And I also purchased from Udemy Ala's questions. So those are also some good questions. So I started practicing the questions. It is not just the so two things that you need to keep in mind. It is definitely like PMP, PGMP exam. If you prepare it well, I'll probably come to the exam day. What I mean, things like that. I mean, like with more details. It would not take you around 4 hours. Okay.
3.5 hours.
Exactly. 3 hours, 15 minutes to about 3.5 hours, you should be able to finish it. Even with the break inclusive, I'm saying. But for you, the first thing is because it's really hard to sit for 4 hours. You need to practice to sit for 4 hours. So these, I would say, attempts that you're taking, you can put your plan. Probably you can take every 2 day an exam as well. But for me, I mean, like my work commitments did not allow me to do that. So every weekend I mean, allotting some time, and I was taking that exam. And one more thing I would like to share is one is the knowledge that you can keep learning. No one can come and say, I'm an expert in this domain. There are still a lot of things that keep coming in, and every day that's how things get evolved.
Yeah.
We are all a student, but when you go into an exam, go with an exam mindset. Look at the, probably I missed to share this, look at the ECO, exam content outline. Understand the each domain. There is a percentage of weightage that is there. So you have program strategic alignment, you have the program life cycle, then you have the benefits management, then you have the governance, and then you have the stakeholder. So you have the 5 domains in program, and even if you get a great score in all 4 domains, and if your program life cycle goes into needs improvement, I think you would not pass the exam. So program life cycle has around, if I'm not wrong, 44% of the questions come from there. So
45%, 75
yeah,
questions
45.
altogether.
Yeah, so that's a huge amount of questions, and I spent a lot of time in that domain. I even had a handy notes. No, I mean, like I took a lot of handy notes so that I can quickly refresh. So that is very essential as well. And last but not the least, a very important thing: standard for program management. Read cover to cover from the book. I read almost at least only 6 or 7 times the whole book. Though the book is very small, but every time I read, I find something new. And when you practice these questions, take those exam kind of an environment, take the 4 hour exam, and then just don't close and then take the percentage that you got. Try to understand why you got the answers wrong. Spend another 4 hours, maybe take a break of 2-3 hours, come back, because if you don't do it on the same day, you will forget, and it's very difficult to understand why did you select an option and then why that option was incorrect and things like that. So try to go and see the explanation, that is whichever material you're using, to know more about why you selected that as a wrong option. It is, again, I would say it's more of connected to the exam content outline, because they want you to think in a certain way. PMI wants you to think in a certain way. So once you understand that methodology, I would say definitely you would be able to crack the exam. For me, I had to push my exam by a week because unfortunately I got COVID during
Yeah.
that time, and I had to cancel the exam. And then PMI, I mean, they are doing excellent, great job. They had like could just provide your case, and they were able to push my exam to a week. I mean, like a week later, and alhamdulillah, I got well soon. I though had a very light symptoms from COVID, and the day of exam is extremely crucial. For me, it was like I would say 24 hours before no phone day, nothing at work. Tell them that you are like either you want to tell them. I didn't tell people that I'm taking exam, but some of my I would say seniors and colleagues know that I'm studying for this PgMP. So they didn't disturb me much during that day. And then my phone was in airplane mode for the last 24 hours before the exam. And don't read on the last day of exam because you have done all that you can do. Go with a positive mindset. Again, it's not life or death kind of a scenario. If you fail, you can come and give it a try again, but you don't want to fail, right? So you need to give your best, and to give your best, you need to have a very, I would say, a strong mindset. So go with a very strong mindset. I would say, and then my exam was somewhere around 10 a.m., but I reached the center around 9:30. The center was free, and then they said, "You want to start the exam?" I said, "Why not? Let me start the exam." So I started my exam a bit earlier as well, and I was able to finish it with a, I would say, 10-minute break by 3 hours and 15 minutes or something like that. So, and I was pretty confident. I mean, I did that tactic. This I do in typically all my exams. I share with people as well. The first 20 questions, I see. I mean, how many questions I'm so surely selecting, or probably I'm just selecting an option and going. And how many questions I am putting for need for review. If the need for review is less than 4 or 5, it really helps me to know that I'm actually going to pass the exam. It's just I need to be calm enough to sit for the whole 4 hours, because that's the difficult thing. Trust me, it's not the questions that are difficult. These are the sitting for 4 hours really becomes a difficult. And if you have practiced it, like at least minimum of 3 or 4 iterations at home or at work, that will definitely help you. And all that I've explained, probably I've missed 1 or 2 points. I haven't written an article because a lot of people reached out to me. Congratulating me and also wanting to learn what are the best, I would say, quick option to attain this prestigious credential. I said these are the options. I've written an article in LinkedIn calling the same name as PgMP. That's my journey of the program management, and I've given a lot of detailed points. Some of the books also have given there, so you can refer to that, and definitely it would help in your journey. And I wish you all the best for your PgMP, and also anything on the healthcare if you want. As I said, we are all learners, and we are learning from this different experience that are there from. Though it is not an I would say a forum where everyone can share their feedback, but if you want any of more inputs that you want to hear from me, or if you have anything that you want to discuss, feel free to connect me through LinkedIn, and then definitely I'll be happy to share my experience and my information.
Great, thank you. Thanks for sharing your journey. It's very insightful. Many people definitely liked it. They're appreciating, and good. So just on some people asking, somebody asking for CCEU code. I don't have any CCEU code. I don't know what is that. I mean, I'm probably going to do research. But what I'm providing is PDU code. This is Professional Development Unit. This is required for maintaining your PMP, PgMP, or PfMP, or any PMI certificates. So I have shared. Can someone let me know if you have seen the chat? And the chat has the information with the course identifier and the PDU code. Okay, so it is there. So please check the chat, and if you still cannot see, feel free to email me, and I will organize you that PDU code. Okay, so that's what I will do. And yes, the books which mentioned by yeah. Okay. So the books mentioned by Ifthiquar, the book is of course Dr. Ginger's question bank, which is the PgMP study guide, and I have my own question bank, and also my complete reference guide and few other things. So yeah, please, and if you still have any questions around what to do, how to get ready for PgMP, what books to read, and how to make my life easier, smoother, of course, you can contact me. And I have shared my the link where you can block my time. So you want to take copy that link, and feel free to book time, and I will be happy to work with you. It's a free of charge. This is no charge for the 15 minutes, half an hour. but you will learn a lot. And even if you don't take my program, it doesn't matter. But it will give you opportunity to learn something from me, and who knows, you may pick me as your mentor and go through the journey, and you'll be sitting with me, talking just like a Ifthiquar, and explaining how easy exam was. So I will tell you one thing. Ifthiquar, you said exam was easy. Exam is easy once you're ready, when you're prepared. It's like if I ask you to go to Mount Everest and you say, Dharam, how can I go there? I don't know anything. But if you're ready, if you're prepared, you've done a lot of climbing, the Mount Everest will be easier for you because you know exactly where to go and how to do. So this is all about taking through the journey. So, but most of the students completing the exam 3 hour 15 minutes. I have a record. I don't want to talk, but yes, one person actually did the exam 2 hour 30 minutes, and he got above target results. Of course, he was prepared and he used Dr. Ginger's book, and he was scoring up to 75 to 80% in Ginger's question. So that was kind of expected from him. So look, it's about the preparation, about the mindset, what you mentioned a day before. Keep the books aside, try to freshen up, have good rest, and go to the exam center early enough so that you're not stressing. So it's all about not only preparation but about the stress management, about your happiness management. I call happiness because if your mind is happy, you're happy, stress free, your exam results are going to be very different compared to, oh my God, I'm going to fail. I don't know if I'm going to pass. I don't have enough information. I don't remember that formula. Just that is creating too much pressure on yourself. Anyway, so that one session, I think the last session we had before exam, that's where I talk about what to do, what not to do in the last 24 hours, the last 7 days. Anyway, so
Yes.
thank you. Yeah, go ahead.
Thank you, Dharmeer. If you just allow me, I mean, like last 2 minutes, this
Yeah,
this
please go
probably
ahead.
would be beneficial. I mean, like, this is not just for PgMP, for anything that you do at life, be it anything career oriented or anything family. Just some pointers I want to share. This is something that I had as a learning experience. Have a very, I would say, a proactive and a growth mindset always. Don't be very fixed, because you can read a lot about that even in the internet. Have a very growth mindset. It helps you to open up a lot of avenues that you really never thought about. Okay, have that and carry the right attitude, because uh, I mean, like, whole funda is all about having the right attitude will direct you into a right behavior, and that behavior will yield you in providing the better, doing the right action, and then the results will come on its own and the performance will come on its own. So have the right attitude at the things that you do, and always view challenges as opportunities. Definitely we have couple, I mean, like, challenges at personal level or at work level that are thrown to us. Always look things as opportunities and see what is the best that you can do out of that situation. Even if you ask me, I mean, during the I would say the initial levels of pandemic, some decisions that we have made, if I can go back in time, would I do the same thing again? Definitely yes, because having that information available at that point in time, that was a right decision to make. So always have, I would say, look at opportunities as challenges, and replace the word failure. Always use learning. There is nothing called failure in life. You keep learning, and then you keep growing with that learning. Everything is a learning milestone, and this is what I tell my kids as well, and this is what I share with my team. And try to acknowledge and also embrace the imperfections. So that's when you will value, you will thank a lot rather than you complain. Even when you drive on a road, you will not complain what the guy is doing on the. Why did he cut from this lane to this lane? I mean, like, he's doing it. Probably he has an emergency. We don't know. So always you embrace the imperfections. You would show a lot of gratitude, basically. And these are some simple things. You can put it in PgMP. You have put it at your project that you're working. Definitely, these are the fundamental principles that you withhold. It will give you the results that you wanted for. So I just want to close that note with that.
No, very, very wisely said, and it's perfectly mentioned. But we done from the program point of view, and thank you very much, Ifthiquar, for contribution, your openness, your willingness to help, and you're showing the path. Wonderful to have you here as my guest. Thank you for contributing to the professionals. and I'm sure people here are appreciating your contribution. And let's continue to do the good work. And I think the more I'm going to come to Dubai, and I will see the more transformation in not only building side but also the people side and the hospitals and other side. Hopefully, I don't have to visit hospital. But if I do go to hospital, maybe you can give me a tour. Dharam, this was before and this is now. So that's the kind of thing I like to see. Not hey Dharam, let's open your heart and open your brain and all.
I'm not a clinical guy, Dharam.
So thank you once again. And I cannot
Thank you,
hear
Dharam.
it. Ifthiquar is saying something. I cannot hear. I don't know what happened here. But at least if you want to say something, people can hear you. But if anybody is still struggling with PDU code, please email me. I will help you. I shared it again one more time, and feel free to call me or take appointment with me, and I will be happy to work with you. And if the car is there, very helpful person, reach out to him. And once again, thank you, Ifthiquar. Thank you all, everybody joining this session. It was wonderful to have you here, and wonderful to have all the participants who are coming again, learning from these sessions.
Thank you, Dharam. Thanks for having me, and thanks to everyone who joined this session. I hope the information that was shared was helpful. I'm not sure if Dharam can hear us, but anyways, thank you, Dharam.
All right, thank you.